The trauma bay doors fly open. Vitals are crashing. You reach for an IV bag. Normal saline, Ringer Lactate, and D5W look identical, but the moment they hit the bloodstream, they trigger entirely different systemic reactions. Effective treatment requires physiological matching. You have to address a specific biochemical deficit without triggering the patient's underlying conditions. We are going to map out the exact rules for when to use and when you must withhold these 3 primary IV fluids. Removing the guesswork from your fluid selection is the primary defense against lethal medical errors in the ER. We start with normal saline, or 0.9% NaCl. Its composition is straightforward. It is salt and water. Clinically, we classify it as an isotonic fluid, as its concentration matches the body's natural cellular environment. This neutrality makes it versatile for procedural tasks, like washing a wound or diluting injections, such as ceftriaxone or pantoprazole. Its internal function is limited to treating basic, uncomplicated dehydration. It also plays a specific, vital role in stabilizing patients presenting with diabetic ketoacidosis. When no complex metabolic limits exist, normal saline acts as the default starting point for fluid volume restoration. The cost of normal saline is its heavy sodium load. As salt floods the vascular system, vessel walls expand under increased pressure. This volume shift poses immediate risk to a struggling heart, triggering rapid fluid overload, making it contraindicated in heart failure. For the same reason, you should avoid administering it to patients with high blood pressure. If a patient's labs already show hypernatremia, high systemic sodium, this fluid is strictly avoided. When a patient's system cannot handle excess salt, normal saline becomes a dangerous cardiovascular stressor. Next is Ringer Lactate, or Hartmann solution. It has a complex biochemical profile containing sodium, potassium, calcium, chloride, and lactate. This specific mixture is the closest artificial match to human blood plasma currently available. This matching profile makes it the preferred choice for expanding blood volume during massive loss from surgery or trauma. It is also the standard for treating patients with severe burns, where maintaining intravascular volume is critical. In specific infectious cases, it is the primary fluid used to manage Dengue Shock Syndrome. Ringer Lactate provides the physiological expansion needed when blood plasma must be replaced at scale. The trade-off for that complexity is metabolic. The lactate and potassium in the fluid must be actively processed by the patient's organs. Severe liver failure is a strict contraindication because a damaged liver cannot metabolize the lactate, leading to systemic buildup. Acute kidney injury is the second major restriction. This comparison shows why. A healthy kidney filters the potassium from Ringer Lactate easily. In a failing kidney, that potassium builds up to toxic levels, triggering life-threatening hyperkalemia. Using Ringer Lactate safely requires the patient to have functioning liver and kidney pathways. Finally, we have Dextrose 5%, or D5W. This is simply sugar mixed with pure water. In an emergency, its role is to rapidly correct severe hypoglycemia. It also serves as a vehicle for delivering specific IV medications that are incompatible with salt. You must account for the shift that occurs after administration. Once the body metabolizes the sugar, only pure, free water remains in the blood. D5W serves as a specialized sugar and drug vector, distinct from the fluids used for hydration or resuscitation. Because of how free water behaves, D5W is never used for general resuscitation. Head injuries are a strict contraindication. Strokes are also an absolute contraindication for D5W. This mechanism is lethal. Unlike saline, free water rapidly crosses the blood-brain barrier and pools in the neurological cavity. This pooling causes the brain tissue to expand against the rigid boundary of the skull. The result is cerebral edema, massive, life-threatening brain swelling. Using D5W in a neurological emergency actively damages brain tissue. This protocol maps your decisions. Every choice is dictated by the patient's specific pathology and their metabolic limits. For massive blood loss, burns, or dengue, your choice is Ringer Lactate. Before you hang the bag, confirm the patient does not have liver or kidney failure. For diabetic ketoacidosis or basic dehydration, your choice is normal saline. The stop check here is cardiovascular. Ensure there is no heart failure or hypernatremia. For low blood sugar or drug dilution, use D5W. Maintain the absolute ban on D5W for resuscitation, especially in cases of stroke or head trauma. Matching the biochemical profile of a fluid to the patient's metabolic state prevents the iatrogenic injuries caused by a wrong choice. Precision in these decisions is the standard for resuscitation.